Hello, my name is Eric Prosher, and I'm a psychologist and outreach coordinator at Jesse Brown VA Medical Center. And you're watching a live call-in interactive program brought to you by CAN TV. And today, Jesse Brown, we have a couple special guests. And our first guest today is Sensei Bret, who runs a judo program for veterans. So if you have any questions about judo and veterans, this is your opportunity. So Sensei Bret, how's it going?
Eric, thanks for having me.
Good to see you again, sir.
Good to see you.
So tell me a little bit about what you've been doing for veterans in relationship to your judo dojo.
Absolutely. Well, we started a program back in 2011 called Warriors Without Limits, and it's our small way of giving back to the veterans who've sacrificed so much for all of us to have the freedoms that we do and sometimes take for granted. And so we started this program to offer free judo classes to veterans of all ages, abilities, anybody with any type of disability or injured, wounded vet as well, and have about 15 to 20 vets right now doing judo with us. And last spring we were lucky enough to partner with the Chicago Park District to offer a second class at Man Park, which is on the Hegwish neighborhood in the south side of the city, every Tuesday morning from 11:30 to 1 p.m. 11:30 a.m. to 1 p.m. for the vets to do the class.
Is this the program you're talking about? Every Tuesday, 11:30 to 1.
Right.
Man Park.
New session starts a week from, no, it starts this coming Tuesday, actually.
This Tuesday.
This Tuesday. And we had great support last spring from Jesse Brown VA. One of the rec therapists, Isabel Mulcahy, drove all the vets to Man Park, and we had a really good group we're looking to build off the success of the first session.
Great. She was on the program last month. So
she's awesome.
So if you have any questions about the program, about the judo, who's the contact person?
So there's two contacts. Through the Chicago Park District, you can contact Luis. It's actually Luis Fuentes. Yeah, Luis Fuentes. And his number is 773-646-009. Or you can contact me directly at 773-230-6070 on my cell.
Great. So maybe for some of our viewers at home that might be shy to ask about judo, can you tell a little bit about what is the difference between judo and karate and taekwondo and jiu-jitsu?
Absolutely, it'd be my pleasure. So judo is unlike many of the other martial arts. It's a grappling sport. It's really not there's no punching or kicking involved. It is derived from jiu-jitsu, and there is some groundwork and some throws, but it's really closely related to wrestling. There's a lot of locking in and throws and pins. It's a great sport. The nice thing about the judo programs we've been able to adapt them to people with various disabilities as well. We are the Paralympic, and Paralympic judo is specific to people with visual impairment, but we actually have 150 athletes each week that have some type of physical, visual, or intellectual disability who train with us. Wow. Many of whom are military veterans, and like I said, for us it's an honor to get a chance to work with them. One nice thing about this program and any of our programs for vets is it's completely free. Of course, we offer the judo gis, the uniforms, and the instruction, and we'd love to have as many vets as are interested. If you want to come once, just to try it out. That's all we ask. Give it a shot. See if you like it. I'm pretty sure you will. And this young man's done our programs before.
That's right.
And
top notch.
Yeah, thank you. And judo. It's an Olympic and Paralympic sport. In fact, I just got back from Rio.
I saw a feature on a blind judo person
Sara
that
Chipps.
made it.
Yes, she qualified for the Paralympic Games. We started our Paralympic program 6 years ago. It was a great honor.
We have a caller already.
Oh, great.
Great.
Hi, Mom.
Hi, caller. What is your question? We're here with Sensei Bret talking about judo. We lost the caller.
Of course. Mom, call back. It's fine.
That's right.
But Sara Chipps, so that was a great honor for us for our Paralympic program, and her sister's in the Air Force, actually. So it's kind of a military, link there. But Sara did great. She got 7th place. She got added kind of late to Team USA because the Russians were expelled from the Paralympics for the doping. Exactly. But it was a great step forward for our program.
What do you think about that gold medalist?
Yeah, it's great. I mean, Kayla Harrison, 2nd straight gold medal. She's become a legendary figure, not only in U.S. Judo, but in world Judo. It's really
Right.
empowering women.
Is that the first gold
She's
medalist?
the first and the second. Yeah,
First and second,
she's won the
okay.
only 2 gold medals, which has been great.
Okay.
So
And then there was a guy there. He was a jiu-jitsu guy. He
Travis Stevens, silver medalist. Yeah,
Silver
81
medalist,
kilo.
yeah.
Great guy. We had a chance to train with them. They train out of Boston.
Oh, okay.
And we went to a camp in April at their club, and they're both world-class athletes and really great spokespeople, and put U.S. Judo on the map internationally. So people are confused. Judo in the United States is a very small sport, but worldwide it's a top 10 sport as far as participation. In Japan, it's a national sport. Brazil, it's right up there under soccer, but right up there with volleyball. So we're just kind of catching up to some of the other countries.
Excellent. So for the viewers out there maybe that are shy to call in with the questions at 312-738-1060, what can a veteran expect on their first day on the mats?
Great question. So what we'd like to do is kind of get a feel for everybody, their personality, and what they're looking to get from the class. It's not usually a good business model to try to be everything to everyone, but we refuse to teach anyone assembly line style where everybody's taught the same, because we have such a vast and diverse student body at our club. So one thing you'll do is you'll get a great workout. For sure you'll get a great workout.
Great workout. Oh, we have a caller.
All right.
We'll pause that. Hello, caller. How are you? You're with Sensei Bret. We're talking about judo and veterans.
Yes, I'd like to ask a question. I'm a veteran, and I did a couple stints tours in the South Islands in Canada. I wonder, you said about judo and jiu-jitsu. I wonder, do you teach Aikido, which came out of jiu-jitsu? I like to take the sport up or the art up, but I can't find anything that relates to that. Do you have to take judo, jiu-jitsu before you take Aikido?
Well, and first of all, thank you for your service. In my case, you do have to take judo before Aikido or Hapkido, because I don't teach those. So judo is a fantastic sport. So I'm sure if you actually contact my number that was on the flyer, I can put you, were you saying Aikido or Hapkido?
Aikido.
Aikido, I can definitely put you in touch with an instructor for Aikido. It would be, I'd rather you come to judo, but what can I do?
Judo is more practical, actually. How about, oh no, we got one more caller.
We lost him.
Okay. Hello, you're here with Sensei Bret. You're talking about judo and veterans.
Hey, how you doing, Sensei Bret?
I'm doing well. How are you?
Hey, Freddie, I got a question for you now. Do you guys take any precautions for the veterans with head injuries?
That's
Oh.
a fantastic question.
Great question.
You know what? We have many, both veteran and non-veteran participants who've suffered some type of traumatic brain injury, and we do absolutely adapt the sport because safety is our number one goal, to make sure it's a safe environment for all of our participants. So we, without delving too deep into personal health history, when people come in, if there's any limitations that they have to let us know, and then we build the program around their needs. So we're not going to put anybody at risk of hurting their head. Absolutely not.
One more question, if I can.
Sure.
Fine with me.
You know what? So what's the difference between your clinic and a regular mental health clinic?
Whoa. So we're talking about judo.
Oh, I thought it was a judo clinic.
Well, it's a judo program. But judo is it's a Paralympic and Olympic sport. So we use judo as the vehicle to overall good health, both physical conditioning, core strength, both mental and emotional health as well. But judo is the vehicle that we use for that.
Judo's the vehicle. Yes. Thank you, caller.
Thank you very much.
Well, one more question.
Perfect.
So if I come to your class, what can I expect on the first day?
That's exactly what Eric you must have
Did you
read
just
Eric's
tune in?
mind, because he just asked that. Well, the first day, we take time to get to know the participant. We spend the first 20 to 30 minutes with a warm-up that includes core strength and cardio, and then we teach proper break falls. So there's practical use to falling in judo, and we'll go over falls, and then we'll do some basic techniques. But I look at this more as a marathon than a sprint. We're not going to try to teach you everything the first day, because I want you to come back the second day and beyond. And third, and most importantly, I want you to be safe. So it's fun. It's easier to explain if you come to class and at Man Park and give it a shot. I did want to say before I get off, Eric, that if this, for our veterans who work during the week, and this Tuesday morning, early afternoon time won't work.
Yeah.
We are also going to have programs on Saturdays that I'm trying to finalize the details right now. But again, my phone number is 773-230-6070, and you're welcome to give me a call or shoot me a text. And I'm glad to give that information for the vets who work during the week. So thank you so much for the time.
Thank you
Eric,
so
I
much.
appreciate it.
Have fun at the game. He's going to the White Sox.
All right, thank
Go
you.
White Sox. See ya. All right, so we have some judo going on, and now we have another special guest. This is Dr. Shmirti Suppori.
Yes.
Did I say that correctly?
Yes.
I'm sorry. So she is a health psychologist, and she is the coordinator for a special program at Jesse Brown VA, which is called Primary Care Mental Health Integration.
Right.
Is that correct?
Yes, that's correct.
So what is that exactly?
So that's a very good question. So basically, primary care mental health integration was created to address certain issues of access. So typically what would happen would be a veteran would come in, and oftentimes the first person they talk to about any mental health issues is their primary care provider, because they have a really good relationship with their physician. They see them over the years. So, you know, sometimes mental health issues, things like depression, anxiety, can be sensitive. So the primary care physician will be the first person they tell about that. Well, traditionally what used to happen would be the primary care physician would then send a referral to a mental health professional in a separate clinic to address the anxiety and other issues. And then what would happen would be the veteran would get lost in between. So because there would be an appointment that would be scheduled for the veteran, maybe it would be a couple months out, and then the veteran would either, I mean, sometimes they lose interest, or sometimes whatever problem they had got resolved. And so then it prevented us from providing the care that veterans need.
So this is about improving access, and this has been a big
Exactly.
theme in the VA, getting veterans in quickly to their appointments to address their concerns. We have a caller already. Great. Hello, caller. We're here with Dr. Suppori, and we're talking about primary care mental health integration.
Yeah, what is the difference between the mental health clinic and this clinic?
So that's a very good question. So in primary care mental health integration, we tend to deal with more mild to moderate issues, whereas in the mental health clinic, they're more likely to deal with more moderate to severe issues. When we treat veterans, we do it in kind of a short, brief way. So our appointments are typically about 20 to 40 minutes long, whereas in a traditional mental health clinic, they would be about an hour long. And we usually do about 4 to 6 sessions of treatment. And then after that, we determine if the veteran's issues have been resolved. And if not, then we would refer to the mental health clinic. So the mental health clinic is really more long-term treatment. And often it's more moderate to severe issues like severe mental illness, psychosis, other things, or depression that doesn't go away. So those are the differences. It's a great question.
I know that like psychologists and psychiatrists are in the mental health clinic. What kind of providers are in your clinic?
Sure. So we have psychologists in our clinic as well, but it's an interdisciplinary group. So we have social work as well. We have a psychiatrist who's kind of a consultative psychiatrist in our clinic, and a physician's assistant. So another part of what we do is medication management. So we try to keep veterans within primary care who are mild to moderate. And so part of that is helping the primary care providers with monitoring medication use for things like antidepressants over the long term, so assessing for symptoms and things like that. So part of our role is to be supportive of primary care.
So so I would get the medication from my primary care provider, right?
That's right.
Okay.
Yes.
Thank you.
Yeah,
Okay.
absolutely.
Thank you for the questions. It sounds like we have another caller. Oh, no, we don't. We had another caller. So, so again, as I was saying before our caller asked those great questions, it's about improving access.
Yes, absolutely. So part of the way we do that is we're on site. So my office is in the primary care
So you're
clinic.
co-located.
Co-located, yeah,
Okay.
exactly. So my office is in the primary care clinic. So if a veteran comes in and sees their doctor for a medical appointment, and they say, you know, I've been feeling down, I lost my wife, or I've been feeling really anxious, I'm dealing with a lot of school issues, what would happen would be then the primary care physician would give us a call. We have an on-call cell phone, and let us know that this veteran wants to see mental health. And then they would basically walk the veteran over to us.
A warm handoff.
So a warm handoff, right? So there's no time lost in between, and we provide immediate care.
Right.
So
You know, that was the idea a few years ago when I suggested the post-deployment clinic that we work in, is because I saw that often I would schedule appointments the same day as veterans had other appointments, and frequently with their newer veterans, you would see that they made one appointment, but then they wouldn't make it to the other. So now that you have it co-located, it kind of connects the patient with the potential providers, gets that personal touch, and increases follow-up.
absolutely. And also we have a personal relationship with the primary care physicians, which is really helpful. We know them well, and we can discuss patients and how best to treat them. So there are a lot of advantages to this model.
Okay, so, but the clinic works on a brief therapy model. So, are there any, the big buzzword, or maybe it was the big buzzword has been for a couple of years now, evidence-based treatments.
Right.
And so do you offer evidence-based treatments in this primary?
So that's
care
a great
clinic?
question. We offer some form of evidence-based treatment. We don't follow some of the typical evidence-based protocols because often they require several sessions. And since we're a brief treatment model, we can't. But more of those evidence-based treatments are being adapted to the primary care context and primary care mental health integration. So I foresee in the future we'll be able to offer more protocol-driven evidence-based treatments, but we do things like cognitive behavioral therapy, we do problem-solving therapy,
Which are evidence-based.
which are evidence-based, we do a shorter version of CBTI. So all of these treatments are evidence-based. They don't necessarily follow the typical protocol, but they are evidence-based treatments. So
Now,
it's good care.
is it all individual therapy appointments, or do you offer group interventions?
Yes, great question. So the majority of our appointments are individual, but we do offer groups as well. So right now we have a healthy sleep habits group because a lot of veterans are suffering from
That is
insomnia.
probably the number one complaint among sleep
Yeah,
habits.
insomnia is a big issue. So in our healthy sleep habits group, we address insomnia and nightmares. And then we have a group that talks about benefits, which actually a lot of veterans have really liked.
Oh, okay.
So it talks about different benefits and what you're eligible for as a veteran. So that group is the second Monday of the month,
Okay.
from 1 to 2:30.
2:30,
And
second Monday of the month.
And it's a drop-in group, so it doesn't have to be scheduled or anything.
Perfect. We'll go over that again. It sounds like we have a caller. If they didn't hang up, let's hope that they follow through. Hello, caller. You're here with Dr.
Hello.
Suppori. We're talking about primary care and mental health integration. Hello?
Okay. Are you talking to me?
Yes. What is your question?
So then I guess my question would be, what can I expect from my first appointment in the mental health integration appointment?
Yeah.
Yeah, sure. So what
Good
we
question.
do,
Thank
it's
you.
a great question. So what we do is we do about a 20 to 40 minute interview to find out why you are coming. So a lot of what we do is patient-centered care. So instead of assessing for all the possible symptoms you could be experiencing, we ask you to tell us your story and let us know what you want help with. And then we do a very targeted assessment of symptoms. So we also look a lot at your health behavior, so sleep, diet, pain, things like that.
Wonderful. Wonderful. Thank you so much.
Yeah, you're welcome.
Thank you. Thank you for the call.
Yes.
For those of you that may have just joined us, you're running out of time to call in and ask your questions. We're here with Dr. Suppori. I'm Eric Prosher. This is a live call-in interactive program brought to you by CAN TV 21. We both work at Jesse Brown VA Medical Center, and we're talking about a new program that Dr. Suppori coordinates that is connected to getting people psychological services in a primary care setting. So call us at 312-738-1060. So when I talked with you before the show, you had a video that you said that might be helpful. Would you?
Yes.
Can you
Sure,
say
I
a few
can
words
introduce
about
it. Yeah. So this video, I think, encapsulates primary care mental health integration pretty well. You will notice that in the video they call it PCBH, which is primary care behavioral health. I think that was what it was originally called, but now it's become PCMHI. But it's pretty much the same exact program. In the video, they talk more about active duty individuals versus veterans, but it gives a good kind of snapshot of what we do. So I thought it'd be a good video to watch.
All right. Well, stay tuned.
I was 20 years old when I came in, the November before 9/11.
Sergeant Brandon Irvin was soon sent to Iraq with 2 deployments in all. Then, at 31 years old, married with 2 young children, he was stationed in Korea for 19 months.
Korea can be a lonely place. And I think that's what got to me. I love my job. I love doing what I do. But not having the support of the family and real close friends was the worst part for me. It was a build-up. You know, you're like, oh, you're sad because you're not at home. Basically, you're not getting something that you need. And I was looking out my window one night and I was like, I'm gonna jump. You know, it was just that quick. And I stepped back and I said, what? No. And I told myself, okay, tomorrow I'm going to see somebody.
We all have situations or symptoms that become obstacles to our goals, whether those are professional goals, personal goals, or educational goals. And to have something like sleep problems, anxiety, stress, depression, to have those things get in the way of serving and contributing and being a part of something greater than yourself, that's a reason to seek services from primary care behavioral health.
Primary Care Behavioral Health, or PCBH, is an innovative blended tri-service program designed to address the needs of service members and military retirees, as well as their adult family members. PCBH is not just for active duty service members, but for everyone enrolled in the primary care clinic. PCBH combines the best of successful programs, the Army's Respect Mill, and the Air Force's Behavioral Health Optimization Program, or BHOP, and expands them across all branches of the military.
One arm is adopted from the Army's program and the other is from the Air Force program. The Army's program focuses on patients who are struggling with symptoms of depression or PTSD, and when they're taking medication for those symptoms, they'll get a care facilitator. They follow up with a service member at regular...
Okay, so you get an idea of how that works. We have a couple minutes left, so I just wanted to thank you for coming on the show. Can we leave the audience with the best way of getting in contact with you and connecting with your program?
Sure. The best way to get in contact with me is to call my direct line. It's 312-569-5486. I'm the coordinator of the program. And you can always come and visit your primary care physician as well and ask for a referral to our clinic. And you can also get connected with us that way as well.
It's called PCMHI.
Yes.
So my name's Eric Prosher. This is Shmirti Suppori, and we represent Jesse Brown VA Medical Center. We'd like to thank you for watching CAN TV 21. You can learn more about our organization by looking at Facebook, www.facebook.com/VA Chicago. And also, this is still September, so we have Suicide Prevention Month, and as a crisis line is 1-800-273-8255. Press 1 if you need to talk with anyone, 24 hours, 7 days a week. The VA is there for you. So please stay tuned for Fathers Who Care that follows us up next. Also, don't forget, it's flu season, so walk in for your flu shots. There's no appointments needed at Jesse Brown, located at 820 South Damon Avenue. Thank you for your time this evening. Thank you for your questions. Thank you.
You're welcome.
Goodbye.